Okay, welcome everyone. We are just loading participants in here. Thank you for joining us at the BC Lung annual Radon Workshop, just at the tail end of Radon Action Month. And we have some really interesting guests today, some from far away. Dr. Jose Luis Villanueva is joining us from Sweden. So you want to wave, Jose?
Hello, everybody. Yeah, it's a pleasure. Thank you, Anne, for the opportunity to present here. So I like to present and to participate with you Canadians in your events. I love your country.
It's so great for you to come from virtually from such a far away. We have some other international guests joining us from the United States, hopefully soon. Noah, have you checked to see if they are in the panelists section? And I think while we're loading, I'm just going to share a screen because I was really struck by the new Stats Can data. So we now have information about all sorts of different parameters that are measured about radon from Statistics Canada. And what's really struck me is that BC Lung has been doing a lot of work over the last few years to raise awareness. And so this is a difference between the number of households that have just heard of radon. So those of you who are familiar with the Statistics Canada survey know there's a lot more data in here. And we have seen some impressive gains just overall. Now more than 50% of Canadians have at least heard of radon, which is great. And we see this overall in British Columbia. And again, Statistics Canada does do a population weighted survey, which lots of people sort of live in Victoria and Vancouver, where we haven't done a lot of outreach. But BC Lung has been doing a lot of work in Kelowna. And you can really see the dramatic increase in the number of households that have heard of radon. And there's more statistics about accurately answering questions, which I didn't include in here. But I just would like to thank the BC Lung Association for their contributions and continued advocacy of this work, because it really is making a difference in a region where we know radon is quite a problematic exposure. Okay, how are we doing for loading people, men? Are we getting close to capacity? And
we're getting there.
Okay. All right. One moment, please. So there will be an agenda today for speakers. I am timing you. Each person has no more than 10 minutes. We've decided to hold questions. Is that correct, Noah? People can put questions in the Q&A and then we're holding them for the end, or can you confirm what the protocol was?
Well, no, I think we'll have a few minutes at the end of each talk for questions. Generally, we've programmed about 5 minutes for questions after each session.
Okay, so for the speakers, I'm going to hide, and then my face will come back on when you're about 2 minutes from the end of your session. If you don't have that long, that's fine. You're welcome to end early, but I would like to respect people's time and keep us on track. And Gary Garrity is joining us now. Great. Okay, and I'm seeing at least 60 participants, men. So I think I will launch us in. So my name is Anne-Marie Nicol. I am a associate professor at Simon Fraser University. I'm also the scientific director of the BC Lung Association's Healthy Indoor Environments program. And I am happy to be your moderator today as we walk through our very jam-packed workshop agenda with lots of different topics with people from all over. So I hope you find it interesting. It is being recorded. If you have questions, please feel free to put them in the chat or the Q&A section, which we can address at the end. And there will be an open panel discussion at the end. If you need to go, feel free to be able to come back and we can add you back at the end. So I am just calling in today from the unceded territories of the Coast Salish, Musqueam, Squamish, and Tsleil-Waututh peoples, the land of which I am happy to live, work, and play in. Okay, so we're going to start actually Brian Rippey's here from the Okanagan. Hello, Brian. Thank you.
Hi, everyone. Sorry for being a little late.
Not a problem, not a problem. Okay, so we have a very special guest and someone who is at least new to me in the radon community, but he's not a stranger to advocacy, and that's Dr. Kong Koo, who's a medical oncologist at BC Cancer in the Kelowna region. And he's trained in Canada and previously worked at Cancer Care Ontario. But since 1992, he's been in Kelowna, primarily there to set up the Cancer Centre for the Southern Interior. His academic interests include community oncology development, tele-oncology, and the treatment of rare cancers. And for the last 10 years, he was involved in cancer advocacy, particularly around drug access. He's been the vice chair of the Cancer Advocacy Coalition of Canada and produced annual report cards highlighting the patchwork access to cancer-saving drugs that exist across the country. So Dr. Koo has some information to share, a personal story that he'd like to tell, and we're hoping to encourage him to join our own radon advocacy here in the province. So without much further ado, Dr. Koo, I will pass it over to you.
Yeah, thank you, Henry, for your opportunity to discuss and share my story. So I'm a medical oncologist in Kelowna. I've treat cancer for a living, and I came in '97 to Kelowna to start up the Cancer Centre. I'm very involved in developing tele-oncology in the interior, and it's evolved into the provincial tele-oncology program for BC. We've been doing telemedicine and virtual care in a very large distributed area with most of the patients in our region outside of our centre. So that's been my work. I've traveled throughout the interior. I'm very knowledgeable of the interior, trying to develop cancer services. Never heard about radon. Anyway, my cancer journey began about 4 years ago. I had an abnormality noted on a routine test, and one test led to another, and essentially they found a lump in my lung. And at that point in time, it was just before COVID. And when they did my CT scan, they shut down my hospital in March of 2020. And they found a 2-centimeter mass. And I said, why should I have a 2-centimeter mass in my lung? I was healthy. I'm a non-smoker. No risk factors for lung cancer. As far as I knew, we were in a high-risk jurisdiction here in the Okanagan. I hadn't heard about it, and I'm very connected, having worked throughout the interior and developing oncology services. And bottom line is, I saw a thoracic surgeon. I remember very first day, because they closed down the hospital because of COVID that day, and I did a Zoom video consultation with our local thoracic surgeon. He says, "You might be an early lung cancer, and but I can't do anything for you. It's too deep to biopsy, so we'll just do a PET scan and follow you." And sure enough, we followed the cancer. It didn't go away. Actually, I have a second lesion. The 2-centimeter lesion was in my right lower lobe. I had a second lesion in my right upper lobe. A year previously, I had a 5-vessel bypass for an acute coronary syndrome. So that one's sort of not very accessible. Anyway, ultimately, hit the bullet. I know about lung cancer because I treat it. I didn't want it there. And I remember the day came back confirming it was a lung cancer. That day, I actually asked myself, why should I have lung cancer? I don't have any risk factors. I did two things. I called up Alan Whitehead at the Radon Environmental, tell him my story, and order a radon meter, which arrives about 3 or 4 days later. And I started measuring my radon levels in my home. I've lived in my home for now 24 years, and I found very high levels. It was in the neighborhood of 500 to 600 becquerels per liter, and way above the sort of Canadian standards. I've been since monitoring my levels. At that time, we were on COVID lockdown, and I couldn't do a radon mitigation right away because we were all unvaccinated. I left my windows open the whole winter to vent out the radon. Just a year previously, my wife had arranged for us to do a one of these television renovation shows, and we had Jillian Harris and Todd Talbot, running through our house, filming a session and doing a major renovation to our house. I had this idea of making our house net zero, and so we were actually part of a Love It or List It TV show, and we replaced all the windows and doors with just the best sort of energy efficient windows and doors we could get, and we probably exacerbated our radon problem. And eventually, finally, able to get somebody to do the radon mitigation. It took 6 months. My wife's studio is down in the basement. She's an artist. Our 10-year-old's Lego room was in the room with one of the highest radon levels. And but I kept our windows open all winter and finally did the radon mitigation. It was a big project because our house is fairly big and it had to have 2 radon systems. And but I'm happy to finally solve that issue. I had been obsessive because I have a undergraduate degree in pharmacology and toxicology, and I was interested in environmental pollutants, and I was sort of misguided because I was going around worried about indoor chemical contaminants. And I never heard about radon. I asked my family physician, he didn't really think about it either. My thoracic surgeon wasn't aware that radon was a problem locally. And I said, well, you're treating all these lung cancers, and I'm probably one of that 20% of patients with a radon-related cancer. And, people are so unaware of the problem. And at that point in time, I also tried to get a CT scan for my wife to see if she was at risk. Because we've been together about 15 years. We met fairly late in life. We're older parents, thankfully. We have a wonderful 10-year-old, but I was concerned for their health. And fortunately, I managed to get a CT scan for her through my colleagues at KGH, and her CT scan was all right. I've recovered well. I've been very interested in promoting amongst my colleagues radon measurements, because when I talked to Alan Whitehead and he told me about the BC radon map, that was the first time I heard about it. And I'm in the business of cancer. And I tried to educate my colleagues, my family physician, and about this issue, and that it's under-recognized. And I'm partly here to share that story. I think there's a lot of people in the energy residential renovation business that also don't recognize the problem and spend huge amounts of money to possibly, like we did, exacerbate an existing unrecognized problem. And I think we need to have better standards for measuring, and maybe standards for mandatory radon measurements, like may exist in other jurisdictions around the world. Anyway, that's my story, and I'm happy to share it further if it helps other people recognize this problem.
Thank you very much, Dr. Koo, for sharing what must have been a very difficult few years for us. for you and everyone with the pandemic, but I can't imagine grappling with this during such a difficult period of time in your life.
No, I think I'm like many other people, many other healthcare providers, we're struggling through caring for our patients, and I was working for the most part full-time through all of this. And, but actually COVID was, for us, because we were prepared with our virtual health and telehealth capability, and oncology is one of those specialties, at least in medical oncology, that a lot of our care can be done remotely and from a distance, and that helped guide me through my own care, because a lot of it was done through that, and I got pretty seamless care through the whole last 3 or 4 years of a very eventful time for me and my family.
Well, we really appreciate your sharing your story. The reality is that when we say less than 50% of Canadians are aware of radon, that includes specialists such as yourself and doctors. And we often encourage people to talk to their doctors about radon, but we need to do more work to educate the medical professionals as well about how important this exposure is. So, your story is very edifying to us in the business, because there's obviously places where we need to do more training as well as just the public. We're going to have to move on now time-wise, but I do encourage you to feel free to stay, or you can join us again at the end of the conference. And thank you very much.
I will be staying, so I look forward to hearing the others.
Great, thank you. Okay, next up we have Dr. Jose Luis Villanueva, who is the Secretary of the European Radon Association and a special advisor to Radonova, which is a company that sells different kinds of radon expertise and test kits. He is a specialist at radon measurement, and he worked for 15 years as a researcher in Spain, where his dissertation was actually focused on radon gas. He has more than 26 publications in the international peer-reviewed journals and participates in many international conferences and workshops and meetings, where I was happy to connect with Jose. And he was the founding member of the European Radon Association and the editor-in-chief of the Journal of European Radon Association. So without much further ado, Jose, do you want to try sharing your slides?
Sure, absolutely.
Okay.
Here we go. Yeah.
Okay, we can see your slides, and your 10 minutes starts now.
Perfect. So thank you very much, Anne, for the invitation to participate today in the meeting. It is already here, it's 7:20 p.m. Absolutely dark. We are in Sweden. So thank you very much, and it's a pleasure to participate with you, Canadians. First of all, before starting, I would like to congratulate you, because you have done an amazing job increasing radon awareness according to the statistics you showed before. So well done, very, very well done. We need to learn from you here in Europe. Okay, so today we are going to talk about the radon action plans in the European Union. And everything is based on the directive Euratom basic safety standards. So for those of you who are not familiar with the system in the European Union, just to let you know, to put in the perspective, so this is Canada here. It's the third probably biggest country in the world, and the European Union is a very small territory compared with Canada. But there are 27 different countries, probably, I don't know, maybe 50 different cultures, languages. So it's absolutely a multicultural pot in the world. Everything in the European Union is driven by something called European directives. So this is like the top level of the legislation at the European Union, and directives they are mandatory for the member states, and they need to be implemented in the national legislations. So this is what happens with the directive on radiological protection. The process to issue the directive took some time, like approximately 2 years, different meetings, different committees, and finally, on the 17th of January, 2014, it was approved. As always in Europe, all the documents must be published in all the official languages in the continent, and the document is available online, and yeah, everybody can have a copy on their own language. You have the link here in the slide. You can check the document later. What is important of this legislation? Well, the directive is absolutely like a revolution in terms of radiological protection and radon in Europe. Before the times of the directive, there were recommendations from the European Commission saying, advising the countries certain levels of radon annual average, but they were just recommendations. They were not mandatory. After the publication of the directive in 2014, it is absolutely mandatory, a reference level in all the 27 European Union member states. And for the first time in the system of radiological protection, we have a number, and this number is 300 becquerel meter cube of annual average radon concentration. And what is even more important from this number, it's that the reference level applies equally to individuals, general public, and workplaces. As you can imagine, of course, it is easier to enforce the law at the workplace level, but to have a number, by having a number in the legislation, make it very, very easy, or relatively easy, to encourage the general public to test and to keep their radon levels under this reference. Well, this map is probably familiar to you. It's the European Atlas of Natural Radiation, a long project. I will not come into the details here, but you need to look at the maps together, these two maps together. On the left-hand side, you have the map of the arithmetic means in the cells of the territory of the European Union. Each cell is 10 by 10 kilometers. But on the right-hand side, you have the number of measurements per cell. And this is extremely important to understand to which level we need to use the map. Okay. The decision-making process is not so complicated. So the radon action plans must identify which workplaces need to be measured. And this depends from country to country. So they need to compare with the reference level of 300 becquerel meter cube, and then apply remediation if the level if the radon concentration is above the level or not. And at the end of the day, if the level is very high and remediations are not sufficient to reduce the levels, they need to evaluate the dose. How to measure? Different countries, they have different measurement protocols, but what is very important is that in all the countries, they follow the ISO standard 11665 part 4 for passive radon measurements, and the measurement services must be accredited according to the ISO standard 17025. And the responsible to enforce this directive is the national authorities. Yeah. Radon action plans are defined in the annex number 18 of the directive, and there are different items that have to be included in the radon action plans. The reason for that is that the level of, let's say, radon development in terms of legislation, measurements, remediations is extremely different all across the country. So we have countries with a high level of expertise on radon and many years of experience, whereas other countries, they are, let's say, newcomers when it comes to radon. So that's why the radon action plans, they need to include everything from the very beginning, radon surveys, to long-term goals to reduce lung cancer risk. Well, the radon action plans at the moment, you can see in the slide which countries have published their radon action plans and which countries not. So I have managed to gather information from 17 countries out of 27, 16 countries from the European Union plus the UK. The UK implemented the European directive and published their radon action plan before the Brexit. And yeah, as always in Europe, the documents are in the national languages, but some countries also make duplicates in English. So 6 radon action plans are available in English. And here in this table, you have a summary of the countries with these radon action plans already published. And you can see that the reference levels vary from 100 till 300 becquerel cube. In most of the cases, the authorities responsible for the radon action plans are the ministries of health or the environment. And when it comes to the dose evaluation, most of the countries use the new ICRP 137 dose conversion factors. You have some interesting information when you check the documents of the radon action plans. I would like to show you some of these slides. In the case of Belgium, for example, they use the reference level as a tool to optimize the radiation protection. In the case of Estonia, they have classified the country in 3 different categories. And in the case of Finland, yeah, they have the areas that they need to measure classified by municipalities and also postal codes. And it is very important to remark in the case of Finland that 1/3 of the lung cancers caused by radon result from radon exposure less than 100 becquerel/m³. Yeah, in the case of Sweden, for example, this is one example of collaboration among different national authorities. Other countries is the same situation. So it's not only one authority or agency involved in the elaboration of the national radon action plan. So, and I would like to finish the presentation with this slide because I think it is very important to be aware that when we are talking about radon, we need to work together. So authorities, research, industry, and the public, all these 4 actors, they need to coordinate themselves. Otherwise, it is useless. So we need to work together. So thank you very much. I think it's exactly 10 minutes. And yeah, I am open for your questions. Thank you.
Thank you, Jose. And, you know, one of the main reasons for inviting you here today was to show that regulation and legislation is possible. And here in Canada, we have a federal guidance document, and we do have the federal government recommending that we do address radon, but we don't have the kind of regulatory and legislative oversight that they do in Europe. But it doesn't mean that we can't have it here in Canada. And I'm just so inspired by what I see in different countries in Europe. I mean, recognizing that less than 100 becquerels is not a safe space, and that as public health people, we should recognize the contribution of lung cancers that occur below that level, because they are significant given just how many homes test under 100. So we have time for one question if anybody in the audience has one. And the Q&As, I don't see anything specific, Jose. But yes, if you're going to stay till the end, then that might be an excellent time to talk. But we're going to be followed up by Dr. Questel here from the BC Lung Association, who's going to talk a bit more about radon work here in British Columbia. And trying to make the connection between, you know, what is possible legislatively and what is possible policy-wise for this province. So Dr. Questel is the Director of Law and Policy at the Healthy Indoor Environments Program at BC Lung. He's a practicing lawyer and has a PhD in human geography. He heads up the Healthy Indoor Environments Program. And for the last 3 years, we've focused on radon gas, exploring the current state of the law and existing duties to protect people from radon exposure and what we need in terms of law and policy reform in this province and honestly in this country. So Dr. Questel, please go ahead and share your screen, and I'm timing you now.
Okay. Oh, I was just showing someone our website. Okay, so we have put out recommendations for a BC action plan. They were posted yesterday, and we encourage everyone to see them. We spent some effort on formatting, and we want very much to make an impression that we should have action in BC. So we've been working on this for a couple of years. I also helped put together the Radon Action Guides by Health Canada. And I'll explain a little bit the process that we've been going through. Now, it's pretty self-evident to the people in this group that radon is a problem. But sometimes we do need to explain to governments why they should act. And there's been a lot of evidence on asking people to test their own homes and pay for mitigation. But what we're hoping to do is to shift the conversation to ask, what can we do collectively as a society to protect ourselves as a society from radon? And that's a public health initiative. It's a way of saving lives. And there's a lot of principles in our legal system which support collective action and law and policy reform. First of all, there's the issue of saving lives, but there's consumer protection and workplace protection. As consumers who buy homes or go into spaces or rent homes, we have an expectancy that things are properly built and will protect us from adverse climatic conditions. And in workplaces, we expect the workplace to be safe. This, basis of occupational health and safety. There's long-standing environmental governance in clean air, and having clean outdoor air is great, but we're actually spending most of our time indoors. And so having clean air indoors is paramount. Economists have really shown that radon action can be cost-effective. What that means is it's a question of how much are we willing to spend to ensure good quality of life or preserve life. And that's a kind of metric we put procedures in hospitals through. But if we shift that to the preventative side, there's no reason we shouldn't be spending money instead of on surgeries once people are sick, on preventing people from getting sick in the first place. We've really been emphasizing that we need to consider indoor air and radon as part of climate and energy efficiency strategies. This is a big project we are embarking on, is to decarbonize our economies. We need to do it in a way which ensures health and safety, and tight buildings with high radon can make radon worse. We want to emphasize to governments that they have legal obligations as landlords and as employers, and they should test their own facilities. And we have chronic disease and cancer prevention strategies and healthy built-in strategies, so radon should fit in. So we've been looking at radon action plans globally, and the World Health Organization has a monitor, a database, and we see very clearly that Canada, unlike Peru and the European countries and the United States, doesn't have a national plan. Now, in order to think about having a national plan, we have to put our mind to all the buildings out there. So radon affects any kind of living space. So we have to think about new and older homes, rented homes, schools and daycares, workplaces, a sort of a broad mesh of thinking about how the built environment, the indoor environment, is regulated. And so we end up, if you even take an issue of older homes, you have to look at all the legal levers, building codes, real estate transactions, new home warranty, to sort of get a cohesive picture of how it is that there is a regulatory frame over the area and where there's a point to intervene. So even if we look at workplaces, Canada's a federal system, and we're going to keep on going back to that. So there's some federal guidance from the Occupational Health and Safety Regulation, but it's often the provincial occupational health and safety regulations which really matter. And licensing for daycares, school acts, municipal bylaws. So we need to look at all of those as places of intervention. So we analyzed what goes into an action plan. And I think what's key is setting a goal. And the idea is we want to reduce radon. We want to reduce elevated radon in buildings. And what we suggested in our radon action plan is, let's give it a date. Let's do something ambitious. Let's not have elevated radon in indoor spaces by 2035 in British Columbia. That's a project we can do as a society. And what we need to do is to take the steps to get there. So we need to make sure we know where the radon is and that we're testing homes. We want to have a reference level. Well, Jose spoke to that. In Canada, we've chosen 200 becquerels. We need education awareness campaigns. In some degree, Health Canada has been doing that, but it doesn't always trickle down to different areas of the province as we analyze. The BC government is going to be responsible for building codes and new home warranty. And then once we start to get to older homes and workplaces, there's a whole host of provincial legislation that we have to look at. Real estate transactions, professional standards for mitigators, residential tenancies, standard of maintenance. And likewise, with workplaces, we can look at occupational health and safety, but we can also look at schools and daycares and municipal bylaws. And finally, having a plan. So Health Canada took the approach, and I took the approach as well, that under the Canadian Constitution, it's going to fall on provinces to do that. That health and environment are gray areas, and traditionally it's really been a provincial matter. So that's why we don't have a national radon plan, and it's why Health Canada instead put out guides. So I just took a screenshot. There's extensive guidance now from Health Canada for municipalities, for provinces and territories. We wrote out legal guidance so municipalities could know that they'd act, and we came up with a document showing justifications and policy rationales for radon action. For BC, our program has been doing extensive research on existing duties, covering areas like commercial buildings, engineers, renters, architects, employers. This is all documents on our website under legal duties, where we've seen where people should be responsible and aren't particularly acting, hoping to highlight existing duties. And we've also put together solutions. We have policy solutions in a number of key areas, such as for WorkSafe BC or for realtors, in energy efficiency projects, a guide for renters. And so it wasn't hard for us to stitch together this into recommendations for a BC plan. And so now we have our major asks in a single area under the recommendations for a BC action plan. Now, we talk about planning and overarching need for planning, but also individual action items. Now I actually just took a screenshot of our recommendation section. I'll go over in some detail key points. As I said, we want to eliminate elevated radones in homes, workplaces, and other occupied buildings in BC by 2035. We need a clear plan. And we explain, part of a plan is setting out what needs to be done and where there's gaps, but also adopting a strategic plan to meet goals and doing so in a way which is measurable and has clear timelines. And I'm just going to go through a few key points. We cover a lot of different areas. There isn't time to go through, but just a few things I want to emphasize, right? There's a broader plan, but there's individual steps, and we have individual asks. So CNRPP is the certification system for radon professionals in Canada. However, it's voluntary. This should be mandated by the provincial government that if you are offering mitigation services for a fee, you should be certified. And so we ask for that. New home warranty. In Ontario, there's clear rules that says people's homes are covered if they have high radon. We need to bring that in BC, and that's going to require action from the provincial government to change some of the wording and the regulations or policies from BC Housing. We are very clear that we're asking for subsidies and financing for homeowners, again, because this is a cost-effective health intervention. We have a public health system. We should have a public preventative health system. That's going to mean that there's in higher radon areas, we help people test and we help them mitigate. And we have to make sure in rented homes that we offer those subsidies, but also we make it easy for renters to test and know that there's going to be mitigation by putting it on the landlord through calling radon an emergency repair, making clear that this isn't a capital expenditure that legitimates landlords raising rental rates, and giving free radon testing kits and tax credits and direct grants and incentives for work and rental accommodation. For schools, there is space for the Ministry of Education to give clear orders that schools across the province are screened or tested. That's already been done now for lead, for allergies and anaphylaxis, for provision of menstrual products. There's clearly a legal mandate to do it. In childcare, again, we can be asking for that. There's a legal mandate. So we have our recommendations up on the website. We're going to be writing letters to MLAs and ministers. We'll provide targeted webinars and presentations. We want to use our networks to spread the word. So we're using this workshop to get you to become involved and send us people to talk to and spread the word yourselves by downloading our recommendations on our website. And we'll provide people hard copies. We haven't printed them yet, but if people come and ask, we'll get them to you. And that's really my presentation. If you have questions, feel free to contact me.
Thank you very much, Noah, for that very fulsome overview of our new Radon Action Plan potential for BC. I did, Lena McIntyre, you had your hand up. Was this a time that you would like to ask a question? If so, I welcome you. Elena's dialing in from Ontario. Okay. Thanks. And then Alan Whitehead had a hand up. Was that a question for Noah? Not hearing anything? Okay. Thank you again, Noah, for a very interesting talk. And I'm going to move now to Jeffrey True. And again, you can put your questions in the chat for Noah and he can help answer as we go on. Okay.
I
Jeff,
need to stop sharing.
Yes, stop sharing, please, and we'll allow Jeff. So while we're getting oriented, Jeff, you have the share screen button on your slide.
I do.
You do? Okay, so Jeffrey, I've had the pleasure of working for Jeff for a few years now. He's got a master's in public health from UBC, and he works as an environmental health and knowledge translation scientist at the BC Centre for Disease Control. He's within the Environmental Health Services line, which includes the Drug and Poison Information Center. And he provides a mix of data management, analytical, and communication support to projects, including outdoor air quality, radon, and substance use. And Jeff is really one of the major architects of the Radon Data Repository in British Columbia and the Radon Map, which is a really innovative tool that we have in British Columbia and that doesn't exist yet elsewhere across the country. So with great pleasure, I reset the time button for you, Jeffrey, and you'll see me at 2 minutes out. So thank you very much.
Thanks, Anne-Marie. Am I coming in clear audio-wise? Am I full screened on the slides here?
2 thumbs up from my end, yes.
Sounds good. So
Okay,
hello,
thanks.
everyone. Thanks for joining, and thanks again, Anne-Marie, for the introduction. So today I'm going to be talking about our map of indoor radon measurement data we have here in British Columbia, as well as the data repository which feeds this map. Before I get into it, I do want to acknowledge that I live, work, play on the traditional, ancestral, and unceded territory of the Coast Salish people. Specifically, that would be the Squamish, Tsleil-Waututh, and Musqueam nations. This work has been supported in part by funds from Health Canada and Carrick's Canada, and we have no conflicts of interest to declare. So I'll start with a quick primer before getting into the data repository and the mapping itself. Radon is an invisible, odorless, and tasteless radioactive gas that comes from the breakdown of uranium naturally found in rock and soil. Radon gas quickly dilutes in outdoor environments, but can accumulate to problematic levels in confined indoor spaces. There are no acute symptoms when you breathe radon gas. You don't cough, you don't sneeze, your eyes don't get watery, your skin doesn't get itchy. What happens is that the radon gas will further decay in your lungs when you breathe it in and emit alpha particles, which damage the DNA structure of the cells there. And this leads to the development of lung cancer, but that occurs slowly over time with long-term chronic exposure. The impact is large, though. It's estimated that more than 3,000 Canadians die every year from radon-induced lung cancer. It's the second leading cause of lung cancer among smokers and first among non-smokers. The good news, though, is that there are clear pathways to reduce harms. It's easy to test for radon. There are several inexpensive consumer-grade products out there, and they're available from a variety of sources. And there are established and effective interventions. We can build radon out of our lives. So our role at the BC CDC, we're a public health agency, so we have to think about how we can support this at a population level. And one thing we can do is increase awareness of radon and engagement for action. Again, it's this invisible, odorless, and tasteless gas. How do we get people to engage with something that doesn't have an immediate impact on them? It's a really tough health promotion challenge. And we can do this in different ways, right? We can engage with the public and incentivize them to test. We can engage with healthcare professionals. And I think from Dr. Ku's talk earlier, I think this is something we have to do a better job at. We can engage program planners and policymakers, something that Noah just talked about in the past presentation there. We can also support policies and programs that reduce barriers to act. This can come in the forms of subsidies, grants, and tax credits that reduce the cost burden of mitigation and acting, again, kind of like what Noah was talking about earlier. Or this can come in the form of mandates for new builds to have radon rough-ins, essentially building so that remediation down the line is less costly. But when we're thinking about these efforts, when we're planning these things, we should consider geographic differences. And we saw from previous presentation, I'm trying to make these links here, we saw Jose talk about how this was done in the European Union. Here in British Columbia, some areas are more radon prone than others. And we know this from studies of surface level radon potential based on geologic risk factors. We also see this from standalone descriptive studies of indoor radon measurements. And we also know this from methods that combine those two approaches. But to do any of this mapping work, we do need indoor radon measurement data. And in BC, this has traditionally been held separately by the number of groups that sell testing devices, by the number of groups that organize wide-scale testing. So a few years ago, we started the BC Radon Data Repository as a means to compile this data together. Now I'm just gonna talk a little bit about the data repository very quickly before going and touring the map itself. So we invited known organizations in BC that hold radon data to participate. Participation is voluntary and formalized with a data sharing agreement. The agreement frames us as stewards of the compiled data, meaning providers continue to own their data. Excuse me, and we would only use the compiled data as outlined in the agreement, which would just be for broad strokes research and health protection work. One would not be able to re-identify a person or building unit with reasonable accuracy with this data, and external parties can request access to the non-identifiable data. We have a formal application process for this, and data would only be released for research and health protection work. So essentially the same type of uses we would have with the data ourselves. So to date, the repository has 15 external contributors representing a wide variety of radon, a wide variety of roles in the radon world, as you can see from the smattering of logos I have here on the right side of the screen. Currently, the repository holds over 23,000 unique measurements in over 17,000 unique buildings. Some of these data providers collect measurements on an ongoing basis, and our data sharing agreements cover that as well. So these holdings can grow over time, and they have grown since we started this a couple of years ago. So going on to one use of this data, which is our public-facing online map. I will exit out of my slides here. Just bear with me. I'll pop over here. You should be able to see this now. So this is where the map lives, up at this URL here, but you can easily find it by typing in BC Radon Map or something along those lines into Google or your preferred search engine. When you launch the map, a pop-up appears describing the content and our central message, but I'm going to close that just because obviously I'll just speak to it at the moment. So the data presented here draws from the repository, but is limited to measurements in residential buildings with only one measurement taken from each building in the lowest floor at an unmitigated state if indicated. You can see these summary statistics at the 5 health authorities, which is the default boundary shown here when you launch it, down to the health service delivery area, down to the local health area, and down to municipal boundaries. These don't cover the extent of the province, so you do need to zoom in to see those a little bit better. I'll just zoom in here on Kelowna, the surrounding area, just to give a sense of that. When you do zoom in, you can better see the base layer we have here, which we put purposefully to give meaning and context to the geographic boundaries. The display statistics are percentage over 200 becquerel per cubic meter, the reference points for Canada in terms of recommending to act, or 95th or 50th percentile. For the percentile values, we have an accessible description of what we mean by that percentile. So just an example, we have a 95th percentile here. You can see in the legend text, the legend title there, as well as the hover, 5% of homes are estimated to have a radon concentration of 500 becquerels per cubic meter or higher, and that falls into the orange bin, 200 to 600. And we chose these bins so that there's aligned with Health Canada guidelines for action. That being to mitigate your home within 2 years if you find a reading above 200 becquerels per cubic meter, and within 1 year if you find a reading above 600. So you can fly around the map and look for a region of interest, explore it further at these larger geographies or down to the smaller ones, local health area, municipality. If needed, you can download all the summary statistics presented in the map, just spits out an Excel file here, as you can see. When you click on a region, we do have some more information. The first thing you'll notice is a 10 by 10 pictogram, visualizing the estimated proportion of homes in each of the 4 concentration bands. What's really important in this, looks like I have 2 more minutes, Anne-Marie, is the text we have here, reminding users that community level estimates do not replace the value in testing one's own home. And in fact, it's Health Canada's recommendation to test every home. As you scroll down, we have to the point lung cancer risk estimates or risk messages. These are the likelihood of developing lung cancer in one's lifetime if they lived in a home within each radon concentration band, for non-smokers on the top and for smokers on the bottom. These are from published estimates, which takes established radon lung cancer risk estimates and applies them to Canadian lung cancer and smoking data. What we want to show here is the synergistic effect between the 2 exposures, and that lung cancer risk can still be quite high for smokers, even if they live in a home with a relatively lower radon exposure. So I'll try to wrap up quickly, go back to my slides here. Oh, right. So we launched the map last year for November Radon Action Month. We did a bunch of promo work at that time. And we're ecstatic to see the map get nearly 5,000 views in that first week. We're seeing a similar spike now as we do similar promotion work for this year's Radon Action Month. And now these are page views for a health promotion data product. It's not the latest viral meme or political scandal, newspaper article. So just to put these numbers into context, our communication colleagues told us that this was way more than any non-COVID content that the center puts out, and even higher than some COVID content, which was really surprising for us to hear. But personally, what I find really interesting is that the map paces around 30 page views per day otherwise, suggesting that this product has value for stakeholders and the public beyond our promotion efforts. And I'll close with this slide here. The top is a screenshot from a local paper promoting a testing campaign in Revelstoke, where they use these estimates from the radon map to help promote the event. And the bottom is from an internal PHSA memo highlighting communication wins in 2021. So I'll close with the message that increased engagement through a map product like this can have ripple effects to other groups so that we can all achieve our collective goal of reducing radon-induced lung cancer. So hopefully I'm on time. Thank you all for listening. And I do want to give a big shout out to all the folks on the long list on the right from the contributing data organizations. We wouldn't have a repository without contributors. And the list of folks on the left, internal collaborators at the BC Center for Disease Control. I'm certainly just presenting on behalf of the team today. So yeah, thanks again for your time.
Thanks so much, Jeff. And you were excellently on time. And thanks for your continued work on this really important tool for policymaking and public health in general. We do have time for a question if anyone has one that they would like to ask live. Or again, you can put your information in the chat. And Jeff, do you mind putting the link to the Shiny app in the chat so folks who aren't familiar with it are able to go and see it? Oh, I think Matthew has already beat us to it. Fantastic. Okay. And so now we're joined by a group of folks. This is their first time coming to the BC Radon Workshop. And Gary, can you hear me?
Absolutely. How are you?
Gary Garrity, nice to finally hear your voice. So Gary is the director of the Radon program from the Washington State Department of Health. And I think he's going to talk to us a bit today about radon on the other side of the border. And I'm sure you're all aware that radon does not respect geopolitical boundaries. So the problems that we face in British Columbia are not dissimilar to the problems that are faced by our friends to the south. So Gary, are you able to share your slides?
I believe I am. You know what? I should probably hit that share screen button and
So
Let's see
we're
what looking at
just,
now.
yeah, we're really pleased to have you come, and we look forward to doing some future collaborations with your organization, because again, a lot of people in British Columbia live along the border. So what you have to say here today is really relevant for a lot of us. So thanks very much. I can see your slides and I can hear you. So was there anyone else from your team that you wanted me to acknowledge at this point in time that are joining us
There's not. There
today?
were. I had a couple of members of my team, of my sister office, our Washington Tracking Network, that were hoping to join us, but they were pulled away on something that took a little bit of priority.
Okay, fair enough. Okay, so without much further ado, I am resetting your timing here, and you will see me in about 8.5 minutes. So please go ahead.
Sounds good. Thank you. Thank you so much, Anne-Marie. Very glad to be here. Glad to share this time with you, and I'm glad to give you a little bit of information on what we do down in Washington, and how we're working to tackle the Radon program, not only in Washington, but also working with our US EPA in kind of promoting radon awareness throughout the United States. So first off, just a little overview of our office and the work that we do, which will get me into kind of set up a discussion or some information around our mapping. So our radon program is funded through the EPA State Indoor Radon Grant, and that provides for a small team of individuals, myself as program director, Kyla Ham as our radon liaison. She also acts as a indoor air epidemiologist for our sister office, and also Lise Williams, who is our wonderfully talented communications specialist. So as I mentioned, our program funding is through the U.S. Environmental Protection Agency State Radon Indoor Radon Grant. We also receive some additional funds from our Washington State Foundational Public Health Services, and this is a legislated funds that provide provide for foundational public health needs. And our program goal is to improve the health of the people of Washington by increasing awareness and reducing exposure to radon. So the operations that we focus on for our radon program, we provide for a radon hotline, which is a point of contact, email and phone for the general public to answer questions and concerns about radon in the indoor environment. We respond to, on average, 15 to 20 contacts per month through that. We also provide for residential testing. We support residential testing for radon through messaging, outreach, education. We're also currently providing for free do-it-yourself radon testing kits. The test kit requests, anybody can, any Washington resident can request a test kit through our online request form. And we'll fulfill and mail that out. We also promote testing in early childhood education and daycare centers. We've done quite a bit of work around that for the past couple of years. And lastly, I'm sorry. We've worked through the program, through the Radon program, and done outreach for licensed in-home daycares. And we've recently partnered just this year, 2022, with our Washington Choose Safe Places program, focusing on center-based daycare under partnering to meet the needs of another federal grant, another CDC grant, to ensure that there are daycares and early childhood education are happening in safe locations. So there's a myriad of issues that the WCSP program looks at, and Radon gladly piggybacks on those issues. So we can do some outreach, education, and encourage testing for radon in those centers. So just at a high level, some issues that we've seen, that we've worked through, that we're working on, that we hope to work through. Inventory delays during the pandemic. We had some pandemic-related supply chain issues, which really affected how we were able to promote our free radon test kit, as we we had no test kits available, none in-house, and were delayed on receiving them. They were back ordered all the way through the time that we went live with our free test kit order. We had to work through a situation, change vendors, and within a couple of months we were able to get test kits in. But by the time we went live, we had already had over 1,000 test kit requests with no test kits on hand. So that was you can imagine a little bit stressful, not a whole lot of fun. We've also found that our setup right now for our request form does not provide for email confirmation of a request, and this creates a little more legwork for us, as we often get requesters that reach out to us and want to confirm that their request went in. So working on, we just at the Department of Health, we just did an upgrade to our the platform that we use for our web pages, and as part of that, we have some new functionality, and we hope to integrate an auto confirmation email to go back to the requesters. Follow through is a big issue that we're continually working on, and that is sending out a free test kit doesn't always get the greatest buy-in. And so the rate at which testers or requesters follow through to the point that they have test results reported is low. And like I said, we're working on several different things to try to increase that rate. Our most effective method right now is direct outreach, but of course that's also the method that takes the most man hours, takes the most legwork. So here in the U.S., I don't know if the situation is the same for Canada, but lab analysis data has not historically been shared with state programs. Historically, the analysis data, test result data, has been the property of the owner of the kit, the person who has bought and done that, conducted that test in their home. With our new vendor, we've recently been able to work through an arrangement where we're able to receive full data for all of the kits sold, used in Washington, not only including the kits that we buy for our program, but those sold by this vendor in Washington through other avenues. And that was based on our agency's publishing of data guidelines online. Typically, this is an arrangement that would take a data sharing agreement, some level of work behind that, and some level of work to maintain it. A few years ago, our agency decided that publishing our data guidelines would be a good avenue to alleviate some of this work. And in this case, working with our vendor, they were able to verify our guidelines, verify the level at which we keep data confidential, especially for small numbers. And we're able to say, hey, yeah, we're gonna be able to share data with you all the way. So that gets us all the way down to address level data, which helps us with our mapping projects. The last issue I want to talk about is prioritization. So when we look at our work, and especially when we look at our work for daycare centers, with so many daycares and early childhood education centers in the state, our projects focusing on them face us with a potential to really drown ourselves in response. With over 5,000 licensed in-home daycares and daycare centers, doing a mass communication really had the potential to come back to if we got a high response rate, it was really going to drown us out being such a small team. So through close work with our Washington tracking network, it has produced good tools in the form of enhanced maps that allow us to focus our efforts where they're most needed and can provide us the biggest bang for the buck, the biggest return. So with that, I want to talk about our work and collaboration with the Washington tracking network and how we've done that. So our custom maps and data sets are the tools we use that we have used to prioritize our outreach and communication to ensure maximum impact for our efforts. So we'll start here. This is the original EPA map of radon zones, and this was originally developed by the EPA in 1993 using data on indoor radon measurements as well as geology. The detail and granularity as you zoom in at the state level is to the county level, and this provides limited usefulness the map suggests that the highest radon risk for Washington is limited to only 7 counties. Not only do we know there are additional areas where radon risk is higher, we also know that risk isn't highest throughout each of these 7 counties. There are areas within each of the counties where radon risk is more moderate. So this starts to give you a look at what our enhanced map looks like. On the left, comparing to the EPA's radon risk map for Washington State, shows relative risk by color: red for high, yellow for moderate, orange for low. We keep the same color scheme for our Washington map. So the right is showing the Washington enhanced map. We created this in 2016, working with our Washington tracking network team and working in partnership with the Washington State Department of Natural Resources. So the Division of Geology and Earth Resources at DNR provided maps and data on radon producing geological deposits and formations, as well as sediment, hard rock geology at a much smaller scale. Additionally, the WTN team was working with the WTN team. We were able to pull in test result data from over 30,000 radon tests from between the years 2000 and 2015. So the Washington Enhanced Map provides a clearer picture of where radon risk is elevated at a sub-county granularity, which has helped us better target our outreach, education, our testing and mitigation efforts. In terms of that project, working with daycares and early childhood education centers, as I mentioned, that there are over 5,000 of these licenses throughout the state. We've been able to use these higher detailed maps to really pare down who we can who we reach out to promote our goal for testing each of these centers. And this is what's really important here, is that we're down to a sub-county geography. We get detail on these maps all the way down to the census tract level. So when we're looking at typical areas like in the middle of the state, where the EPA radon risk geology map might show low, moderate, or low radon risk, we know that there's several pockets where there's really elevated radon risk. So we can really focus at that census tract level and do our outreach to those daycares and early childhood education centers that are sitting in what we've been able to map as a high risk area. So our Washington maps provide even more information, as they allow the map user to select and include additional data to view as a map overlay. So in this slide, you're looking, the upper images show Washington's enhanced radon risk map at full state view on the left, and to the right at a tighter sub-county area. The lower images are the same exact map, same exact scale, but with the overlays for child care centers and geology included. So another platform, another map that we have is our WTN On the Go. It's an additional visualization platform. It's focused on optimization for mobile devices. What's particularly nice about this, not only is a user not only provides the user an image optimized for viewing on a mobile device, but also improves functionality, allowing the user to see information about the radon test data collected for a particular area by focusing in, hovering over a particular area. It'll bring up all of the result data there. It also provides a nice interface that we can provide some on-map reference information, a few radon FAQs to help better inform the user. All right, and that brings me right to our end. If we have time for questions, I'm glad to field. Anne Marie, I'm not hearing you. Maybe you're muted.
Yep, I was muted. Yes. Great. Yeah, great work on the maps, Gary, and thank you very much. We do have time for a question or two if somebody would like to put one in the chat or ask one live. I think what stood out for me, Gary, from your talk was, we've also recently seen higher levels in the Okanagan, and sort of the history behind British Columbia was when they first did the original surveys way back in the 70s, BC was kind of written off as a province that wasn't really a lot of radon in. And there was a lot more focus on other parts of the country. And I think over time, with the work that the Lung Association has done, and then just a general overall realization that the central part of British Columbia, the sort of diagonal swath, and the eastern part have quite high levels, which corresponds a lot to your map as well. But I was struck by the Olympic Peninsula. And was that surprising to you to find areas there that were elevated in radon, or had you had a priori knowledge about that going in?
So for me, I wasn't with this group back in 2016, but looking out of my dining room window where I live, and I can see the Olympic Mountains on the peninsula, no surprise at all, really.
All right. Because Vancouver Island still remains an area that we haven't done a lot of testing on, and it would seem unsurprising that the geology is, just not dissimilar to where you're at in the state. So, so thank you very much. I think that was really interesting for me and some of the other map makers. So feel free to put some comments or questions for Gary, and then we'll have you back at the end at the panel. So thanks.
Certainly, and I'll just put a quick plug or an apology in for my colleagues with the WTN program who were hoping to attend today. So both the Radon program and the WTN, or Washington Tracking Network, reside in the same office. The Washington Tracking Network does a tremendous amount of environmental mapping for Washington State, and that's we've worked with to really enhance these maps. And certainly my colleagues are open to future collaborations and any questions that they might be able to help with your mapping efforts as you move forward.
That's great. We actually have some daycare work that's been done in our Okanagan region north of the border. So you might want to connect with Greg Batalon from Interior Health. I put a plug in for him here as well to talk about that. And we had questions about whether or not the free test kits, can anyone approach the government and get a free test kit in Washington State, or was that just for that project that you were speaking of?
So in this group, I'll put it this way. Anybody, it's a public facing website. Anybody can fill out a request form, but we'll only mail to people who are residents of Washington to a Washington address. Okay,
and that's the data that you use to help populate your map?
Yes. Each year we do a pull, we do a request for each of the 8 national labs and request that data back. There's been a historical issue with labs not wanting to provide address level data for tests that aren't purchased by Washington State. But that's one of the things that was really neat with our current vendor. When we made that change, we were able to point them in the direction of our online data guidelines, which really served the purpose of a DSA. Really took that level of work out of it. So that was really nice. We're pursuing the same kind of arrangement with the other labs, and hopefully we'll have some greater success there.
That's great. I mean, I would encourage you and Jeff True to talk afterwards about the data sharing agreements and some of the stuff that we're doing here in BC, which is along in a similar vein. Okay, well, thanks so much. We're going to move on to Chantel Wilson now, who's a professional mechanical engineer with Falcon Engineering, and she specializes in radon and energy efficiency. And if any of you are familiar with my work, this is a particular area of interest to me. So Chantel is a radon measurement and mitigation professional. She previously had her own radon mitigation company, and she has done a fair bit of work for the Lung Association to do some research on homes with new construction and radon systems that are built in. So without much further ado, Chantel, can you share your screen, the buttons and everything ready?
Yeah, I think I can here. So.
Do you want to go ahead?
Can you see that?
Yeah.
Okay, perfect.
Okay, so Chantel's going to talk about some research that she's done recently on the implementation of the newer BC the BC building code. So thanks, Chantel. I'll
Thanks,
see you
Anna Marie.
in 10 minutes, okay?
Sounds good. Thanks. So I want to acknowledge that I am fortunate to live, work, and play on the traditional lands of the Sinayaks, the Shwetnik, the Silks, and the Tanaha. We have just wrapped up the research project for looking at the radon rough-ins and assessing the building code requirements for the radon rough-ins. And that, I believe, just got posted this morning to the BC Lung Association website. And Noah, I think, is going to pop that into the chat, the link to that. So I'm just going to go through a very quick summary of it. You're going to get a lot more information in the document. It's about 60 some pages long. So I'm just going to do a little Cole's Notes version of it here and give you a high level overview of what we found. So we looked at 89 homes in BC. About half of them were occupied homes and about half of them were under construction. So that way we got to see different aspects of the home and different homes, and got to talk to homeowners, and as well there was interviews with building officials, builders, developers, and installers. And the principal investigators and collaborators on the project were Dr. Anne Marie Nicol from the Simon Fraser University, Dr. Noah Quastel from the BC Lung Foundation, and myself from Falcon Engineering. And it was funded by the BC Real Estate Foundation and the Vancouver Foundation. So in general, we found that the BC building code was being followed. So the items that were stipulated in the code were being followed. What we did find, though, that the builders were rarely going beyond the letter of the code, and that the code provisions had significant gaps that allowed substandard systems. Some of the building inspectors had recognized that there also were significant gaps and issues with the systems, but because the code did not make any stipulations on these different topics, they cannot actually enforce anything more than the letter of the code. In the vast majority of the homes, the radon rough-in had significant flaws that would undermine its usability. So in almost every home, there was one issue or another that would affect the usability of the radon rough-in. We also discovered that homeowners often do not understand the radon rough-ins. Some of the homeowners often believe that the radon rough-in protects them from radon and that they don't need to then test for radon. So there was that kind of general misconception. A lot of the homeowners hadn't tested for radon. They didn't know what the radon rough-in was for, and a significant amount of homeowners didn't know where the radon rough-in was actually located. And we also found that there was a general lack of awareness and knowledge of radon by the trades. So they put the radon system in, but they don't have an understanding of if that system's to be activated, how it works, what are important key aspects of that radon rough-in. You know, they'll put the pipe in and they'll do the sealing that they need of the slab, but then they'll cut big holes in the slab and they'll leave those open, not understanding how that affects the radon mitigation system. So I'm just going to go through some of the technical aspects and provide some photos of some of the stuff that we found. In pretty much, I think it was in every single building that we looked at, they were using a thin-walled pipe. So the thin-walled pipe that they're using is a drain and sewer pipe. And that sewer pipe is only rated to be used below grade. So it doesn't have much puncture resistance. It is not UV stable, and it is very thin. And so on the left-hand side is a profile of that pipe. On the right-hand side is the pipe that is radon mitigators we're supposed to be using. So that is it's a much greater thickness. It's often referred to as a Schedule 40 pipe. So that one is more durable, and a lot of the radon mitigators have, when they go to site, they have this thin-walled pipe, and the pipe is there. You know, they want to help the homeowner out and use it, but in all the mitigation standards that we have, says we can't use that kind of pipe. So it puts them in a conflict there. The other thing that we found was large holes in the slab. So They will often cut holes, or there'll be a cutout, it's called a cutout, underneath the tub and the shower. So when they pour the slab, this cutout actually has no concrete in it, and it's so that they can attach the plumbing for the tubs and the showers on the lowest level. Often that cutout is just left open, so it's just a big void to the ground. And in many cases, it's drywalled and you can't see it. So there's this big hole in the slab, but you can't actually see it, and it's difficult to access. On the right-hand side is a photo of a sump lid. So around that sump lid, you can actually see the radon rock and the porous slab underneath. So that's just a direct connection to the ground in that case as well. Here's some more photos of where the air barrier is compromised across the slab. Many homes had conduit where their electrical may be running up, or communication wires or water lines, and that is often just left wide open to the slab below. Here's another some photos of where the air barrier is not continuous. So on the photo on the left, on the kind of the bottom of the photo, it is the wall. So that's the wall and the vapor barrier of the wall coming down. And then
Have we lost your audio, Chantal? Okay, can people hear me? Chantal, I think we have a problem. Chantal is calling in from the interior of British Columbia, so it's possible that her connection is poor at this point in time. I do think we lost Chantal. Noah, can you try to chase Chantal down? Let's okay, we'll give her a minute to try and get back on. I think we could move to Dr. Rippey's presentation here, perhaps in lieu. Are you ready, Dr. Rippey? And then we can circle back to Chantal once she gets on.
I can do that. And it's not doctor.
Oh, sorry.
That's all right. Fair enough. But I'm also in the interior as well. So hopefully I don't get frozen the same way. So,
well, let me give your bio and then you can jump on and talk. So Brian is a new addition also to our Radon Workshop this year. So thank you very much for joining us. He's got 15 years of experience in sustainable design and construction management, and he works as a consultant for governments, NGOs, and international agencies on sustainable building. He has his renewable energy and LEED accredited professional certifications, and has worked with the U.S. Green Building Council rating systems on LEED certified buildings. And he's an instructor in the Sustainable Building Technology program at Okanagan College, which is where I first met him. And given our real interest in the role of energy efficiency, oh, there's Chantal back. Chantal, we're going to have, let's see, do we want to continue with yours, or shall we move to Dr. Brian Rippey and come back?
Whatever works best for you guys. I have it still up on the screen. Not sure what happened there. All of a sudden, I was talking
Brian,
to myself.
Sorry, we'll circle back to you, Brian, once Chantal is finished. Apologies for
no problem.
Okay, thanks for being flexible. Okay, Chantal, we were right. You were showing us pictures of the difference between the pipes.
Yes, let me just bring that back up here. I'll share that.
Okay, and for those of you who are new to this topic, these systems are systems that are required to be built in communities that are designated, and the BC Building Code, which does not include all communities in British Columbia, what used to be Zone 2, but now it's on a community by community basis. And this is considered the progress of the building code for radon abatement going forward. Okay, Chantel, looks like you're back up and ready.
Yeah, back up and running here. So on the right-hand side, you can see there's just a big gap that's open to the ground as well on this one. In the BC Building Code, in a different section that the radon rough-in is located, they talk about how the wall slab joint needs to be sealed with a flexible sealant, and we did not find that in any of the homes that we had looked at. So we get a gap where air leakage and can occur, and that creates an issue when you're trying to activate that radon rough-in, and it's also a pathway for radon to enter the home. The other issue that we saw was fan space. So often there was no space allocated for the fan. In the BC Building Code, it says that you need to put in a pipe, but it doesn't actually say you need to leave any space on that pipe for a fan. So on the left-hand side, you see that the radon pipe is kind of tucked behind the central vac and the water softener. And on the right-hand side, this is the only space that you would have been able to put a fan in because it was finished on both sides of that pipe all the way through the house, would be in the attic, and we just don't have enough height to put a fan in. So in this case, that radon rough-in would have had to be moved. Here's another example of this home. It's the same home, both photos, just different floors. And this home has a flat ceiling, so there is no attic. So on the lower level, which is on the left, it was a hallway on one side and a rec room on the other side of the pipe. And on the upper floor, it was the living room and master bedroom. So there was just no space that a homeowner would want to pull a section of the pipe out to put a fan in. And so that in that case, that radon rough-in would likely have been abandoned. And just here's some more photos of the pipes. There has been a study done by Grace Sue of the NRC where she was studying the passive stacks. And the main difference between a radon rough-in and a passive stack is that the passive stack minimizes the use of elbows, and that lets the natural stack effect up the pipe create a bit of a draw of the radon up the pipe and helps reduce some of the pressure of the radon below the slab. So with that, it can naturally reduce the radon levels in the home. And so the more elbows you have, the less that stack effect is going to help by reducing the radon levels. So in this case, we found lots of the homes were using several elbows. So if the radon rough-in was minimizing the use of those elbows, the radon in the homes would just naturally be lowered. It still may need a fan, but it would just naturally bring some of those levels down. There are also we found some subslab issues. So often the pipe is just terminated right into the gravel. And so it'll just be a solid pipe that terminates into the gravel, and that end of that pipe can often get plugged. So on the left-hand side is a photo of a scope that was put down one of the pipes that we weren't getting any communication on. And it shows how that pipe is just completely packed with rock. So the CGSB has some guidelines on how to put the subslab piping in, and they recommend putting some perforated pipe in, which would help alleviate that. The other thing that, in speaking with other radon mitigators as part of the study, they found that often if there was a footing that would separate sections of the foundation, that the pipe did not open up into the other sides. That was another issue that was discussed as part of the radon study. So some of the solutions going forward that we're recommending is improved technical specifications. There is a very thorough document, which is the Canadian CGSB standard, which is the radon control options for new construction in low-rise residential buildings. And we find that this document actually covers off a lot of the issues that we were finding. And so one of the recommendations is to implement a lot of the different technical aspects of that document. We also would recommend that the proper passive radon systems are installed, so minimizing the use of the elbows to help the natural stack effect in those systems, which will naturally help reduce the radon levels. and improved education and training. So education and training for both homeowners and trades, builders, so that they have a better understanding of how the radon systems work. And also the need for post-occupancy testing. A lot of the homeowners weren't testing afterwards, and some of them had the misconception that they were protected by radon because they had a radon, protected from radon because they had a radon rough-in system in their home. Also, engagement with home warranty. In Ontario, the Tarian home warranty does recognize radon as a defect, and that if the home tests high in radon after occupancy, that they can make a claim under the home warranty program. So that is another recommendation that we're making. And also looking at the locations requiring radon rough-ins. So the BC Building Code requires the radon rough-ins to be located in certain locations where there is potential for high radon. But with the mapping that and the mapping that Jeffrey had talked about the BC CDC is doing, they're finding that there are some locations that are seeing areas of high radon, but they're not listed on the BC Building Code list as requiring a radon rough-in. And that's the end. So I'll be around at the end as well if anyone has other questions. So thank you very much for your time.
Thanks so much, Chantal. Sorry we lost you there, but we were pleased to get you back. And yeah, thank you for this really important work. I think the point that most people who have a system think that it's going to solve their radon problem and that we're building it out. I think your evidence stands in stark contrast to that opinion. So I really appreciate your contribution. We're going to hold the questions and move on to Brian Rippey now, and then we'll have everybody come back for the panel. So thanks so much, Chantal, and thanks for the technical getting back online. So, okay, Brian, let's hope that you all the tech stuff works for you. And I'm going to start your 10 minutes now. Thanks.
Okay, great. Thanks, everyone. This has been really fascinating so far. Design, in particular, deep energy retrofits is what I'd like to talk about today. For those of you that may not know, deep energy retrofit basically is energy conservation efficiency measures applied to existing buildings, achieving performance in terms of energy use of greater than 50%. So there's going to be a direct correlation between this and some stuff we're talking about here today with radon. So what I want to do is give you a little bit of background on why it's important to understand deep energy retrofits, because moving forward, if we're going to meet our climate targets, we're going to need to see more deep energy retrofits throughout the world. As 33% of their greenhouse gases come from buildings that exist right now and are going to continue to be around for 50 to 70 years. We can't simply build our way out of this. We can't, abandon the existing stock buildings and all move into brand new net zero energy buildings for a variety of reasons. And one of those two is just the embodied energy associated with when we build new. So the great thing about deep energy retrofits is not only do they build in these energy efficiency measures in our homes and make our homes more comfortable, but they also have resiliency built into them. And by resiliency, I'm talking about passive survivability when we have these more frequent and extreme climate events and may lose power in a building. We have the heat waves associated with previous summers. Here in BC, it could be cold snaps or ice storms like they've had in Quebec in the past, et cetera, where we're able to stay in our buildings and basically be somewhat comfortable despite not having power. So they can serve as areas of refuge. But one thing I'd like to point out is when we talk about deep energy retrofits and the incentives and grants that come from both a province or national governments, they're really focused on measures that are energy-based, adding additional insulation, making our buildings much more airtight, air sealing through improvements in window technology, membranes, caulking and sealing areas, And so while it's important to have a focus on that, because that's where we have quite a bit of energy loss in our homes. We also need to pay attention to how we're going to have air changes in our homes and improved ventilation. Unfortunately, to my knowledge, both the provincial and national government here in Canada does not provide any incentives for enhanced ventilation. Somebody can correct me if I'm wrong, but I haven't seen any, at least on the NRCan grants for up to $5,000, or even the NRCan Greener Canadian Greener Home Initiative that has a loan attached to it up to $40,000 for a zero interest loan over 10 years, I believe. So the great thing about deep energy retrofits is we can check a lot of boxes here when it comes to both meeting tomorrow's climate needs, but also making ourselves more comfortable and having homes that are going to be more durable. So some of those strategies that I talked about just lead to things like tighter buildings. And so right now, typically any home built, pre-1980s can see a number of air changes per hour of 30 to 40 air changes per hour. That means within 1 hour, we can change all the volume of air in a given space 30 to 40 times. If you have a home that's built post 2018 in a place in BC where the municipalities adopted the energy step code, in this case, step code 1, that can be anywhere from 3 to 4 air changes per hour. So an order of magnitude significantly tighter. As we proceed into what we call net zero energy homes, it gets tighter, down 1 to 1.5 air changes per hour. And then passive house being sort of the highest standard for air changes. These are extremely energy efficient buildings, very super insulated, and they have an air change of right around 0.6 air change per hour or lower. Now, there's a variety of places that we lose energy in our buildings and have air leakage, and we've gotten a lot better in terms of our strategies and technologies to make our buildings tighter. And as well as we have technologies that help ventilate our buildings when there are. So in 2017-18, BC adopted the BC Energy Step Code. And this is a code that's been adopted by several municipalities, which is really doing a performance-based standard that requires new homes, this is for new construction, to be incrementally more efficient as higher levels of step code are adopted. As an example, here in Penticton and Kelowna, we're already at step code 3, which is a 20% or more efficiency improvement over the base case. And by 2032, we will need to be at step code 5, which is a net zero ready construction. And based on that previous slide I showed you, that's an air change of, on average, 1 to 1.5. It could be lower, could be slightly higher, but it is performance based. And they do that through a combination of modeling and blower door testing. So right now I'm currently taking a sabbatical and I'm doing a research project on my own personal house. It's called the Okanagan Deep Energy Retrofit and Modernization House project. And I apologize for this busy screen. It's just the info for, I'll quickly just kind of go through it. Really the target for this project is taking this 1953 home. You can see it up here in the right-hand top corner. Pretty standard bungalow with a hip roof system on it. You still see those homes being built today. It's a nice perfect box, which is a great shape, but it's indicative of a lot of homes that we see here in BC. It started out with actually fairly good air change because it had some retrofits done over the years at 8 air changes per hour. The goal is to get it down to less than 1, but it's also to show that we can take these existing homes that are old, in this case, this particular home, and keep most of the actual materials in the home. Right now, we're at 80% of the original structure is still intact. You can see the design rendering below it of what it's going to look like when it's done. Down here in the bottom left was a phase that we were at a couple months ago. And we're trying to basically, show people that you can keep these existing buildings and meet the highest level of energy step code. Essentially, this home will be net zero energy ready by this spring. So that's it in a nutshell. Anne-Marie, you came back on. I'm wondering, was that a 2-minute warning?
Yep, that's your 2-minute warning.
Okay.
Is that okay?
Yeah, that's fine. So basically, there are some things related directly to radon for this particular project that I'm kind of excited about. So when I purchased this house, actually, before purchasing, we did some radon investigation, and as well as after. And in that first year, we were seeing, without any type of mitigation, levels of 300 to 400. And this is in the finished basement bedroom that has an occupant in it at occupancy sleeping level of 300 to 400 becquerels per meter cubed. I did install a mitigation system, which radon fan with the appropriate scheduled 40 pipe with subslab depressurization was achieved of 150 to 200. So basically, essentially, we were able to meet that threshold that's in Canada of 200 through the subslab depressurization at a cost of around $500 out of my own pocket, and a very easy DIY job. What I'm excited about is post retro. Quite a bit more airtight, and we're going to have some other having an ERV, whole house ERV system installed, which basically will allow us to turn it off and on and see what the difference it makes. But also we can slightly positively pressurize the building as well to hopefully reduce that pressure difference between the exterior and interior and see how that affects it. So these are the typical measurements, what I'm hoping to be able to do with nothing, no mitigation on, the subslab depressurization turned off, no EVR on, and then isolating those two elements, the ERV and the subslab depressurization, and then working them together and seeing what the results will be. So hopefully in a year's time, I'll have some good data to present on that. I'll leave it at that. Any questions? Or do I have time for questions?
You do, you have time for questions, and then we're going to be inviting the panelists back. So if someone has a question, I'm just going to check and see. Oh, Noah has a question here. I will read it out. Brian, were you able to detect any energy draw from the radon system? And if that was an issue for your net zero goals?
You know, those radon fans are such a small, is a misnomer. People have the idea that if we're running these fans constantly that we're going to be using a bunch of energy, but it's really minor. In fact, when we talk about loads in a home,
Brian has frozen for me.
Oh,
there you're back. You're back.
Yeah.
Maybe just repeat that last sentence again, Brian.
Little draw. When we talk about overall loads in a home, or plug loads for that matter, even the continuous operation of a radon fan is minor compared to other loads.
Great. That's good to hear, actually, because we often say, well, then you're going to fan and now our energy use is going to go back up again. So I've heard you can get a new radon fan down to 1 watt draw in an ideal scenario has been a response from. I have a general question for you, which is, I really appreciate your work with radon that you're measuring, and I just would like to. I'm wondering how widespread awareness of radon is in your field. Would you say?
Right. And that was something I wanted to add, but I didn't know if I had time. It is,
Yeah.
it is almost non-existent, unfortunately. I go to these conferences, Living Building Challenge, the US Green Building Council, indoor air quality quite a bit. In fact, there's been a big shift to the focus on energy to indoor environmental quality, but it's rare you hear discussion on radon, unfortunately. So even in professionals that are very cognizant of indoor air quality in the built environment, it's really, I'd say it's just starting to emerge. I think that it would be great to see a little bit more enthusiasm on part of our sector when it comes to that.
Right. And, I think a lot of this complements the work that we've done at BC Lung around recognizing that, we need to address our existing housing stock, that we're not going to be building so many new houses, that the problem is, and as Chantel's work shows, that, we're not even building things necessary to reduce radon accurately. So yeah,
Well,
paying attention to
just to add to that real quick, I have a lot of clients that build high level passive house homes and meet higher levels of BC step code. And if you're not pushing them to do radon testing after the fact, it just does not happen, right? So they could be sealing themselves up. And even if with active air exchange, it doesn't necessarily mean they're going to be below that 200 standard.
Right. I agree. Okay, well, thank you so much. I mean, I think that what we really learned here today is that starting with Dr. Koo and ending with yourself is that, there are other professionals that we need to be bringing along in our radon journey. We focused a lot on public health, but the reality is that it's people outside of public health in the actual traditional medical professions and builders and people such as yourself that we need to really be expanding the partners that we're bringing along with us for our radon outreach and advocacy work. Well, thank you very much. And I encourage those of you to share on the panels to share your screen now. Thank you all for, it was a kind of a gunshot of different, sorry for the analogy, a widespread of different topics, but I think you can see that they all really coalesce around the different facets of radon where we can start to have, better policy, more comprehensive understanding of what exists in the ground and how that drives policy and in homes, public health. Hello, Gary. And yeah, just, what are we doing to our housing stock going forward? And who else do we need to bring along to the conversation? And that's something that I'm really worried about, and would welcome some thoughts of who else needs to be here. We do meet every year in BC with the BC Lung Foundation's workshop, and I am always keen to go and grab people from different disciplines and bring them in. And it sounds like we need an HVAC person possibly to come and talk. So yeah, I'm going to open it up. It seems like there's lots of comments and conversations coming in. Noah, was there something from the questions? I know you've been answering questions in the chat and the Q&A. Is there anything you'd like to reiterate that people might have not seen go by?
Well, Brian was asking about grants on energy efficiency and if it covered IAQ and radon. And we did look into that in a report on radon and energy efficiency gaps in the system. And there are a few grants and subsidies that cover radon, but most of the large energy efficiency ones don't. Canada Greener Homes, Clean BC, you're not gonna, and so we want to actually talk to them because we think it's a pretty significant liability they're creating. If you seal up a house, you're putting people at risk.
And I know Pam Workington might be somewhere in the crowd, but I know that Pam has been looking at mitigation grants across the country in different provinces, and Saskatchewan and Manitoba have different approaches to this. And of course, the Tarion Home Warranty Program in Ontario, if you have a house that's less than 7 years old, you can test for radon and have the system put in for you at no extra charge. And, something like that for British Columbia might be really important for people. I think it would probably help Dr. Koo in his navigating with folks who have developed lung cancer and are, like to be able to think about being able to mitigate their homes if they have high levels. I don't know, Dr. Koo, as you started us off, I'm interested in your reflections on what you've heard today. If you'd like to share some thoughts with us. So the questions are coming in.
Yeah, no, I'm seeing a lot of my colleagues and medical professionals starting to measure radon because I keep pressing them to. And our cancer center has actually radon meters that we loan out, and we're finding elevated home radon levels. I've also tested workplaces and things, and even schools, but we're finding it, and there's not a whole lot of radon professionals in the interior, and some of my colleagues have actually undergone radon mitigation, and their levels are still sky high. And I don't think everybody is properly certified or know how to deal with the tough cases. I guess we had a professional recommended by Alan Hyatt who did a really thorough job, but it took almost 3 times the time. It went from 2 months to a 6-month project, and it went from a few $1,000s to $18,000. That's how much our radon mitigation cost. So these costs are substantial. I mean, we also did a big deep energy retrofit. Like just the windows and doors themselves cost close to $100,000. I mean, that most houses in the interior are on a slope on bedrock overlooking the lake, but there's risks associated with that in terms of increased prospects of radon. So yeah, it's all tied in together, and I've just spent a lot of time actually just learning myself and going through this journey and meeting people like Alan and my radon mitigation guy who's taken me through the ropes, and I've seen some of the examples of really, I shouldn't use the word shoddy, but inadequate radon mitigation systems in new homes, and people not testing and assuming certain things which they shouldn't. So I think there's a lot to get out there, and you're going to need a multi-pronged approach.
Yeah, I completely agree. So is it Gary Cook had a hand up? I thought I saw a hand up. Men, is that right? Someone has a hand up? Craig Cook, you have your hand up. Did you want to ask a live question? Are you calling in on the phone? Can you hear us? Oh, in the meantime, Pam has said that there is a new program, the Lung Matters Grant Program, that provides financial support to individuals who've been diagnosed with lung cancer, and individuals considered low to moderate income priority to them, but there is an opportunity for people to access that. That's a national program through the Canadian Lung Association. Okay, Craig, when you have a chance, maybe write your question in the chat or the Q&A. I haven't seen it yet. Jose, you have your hand up.
Yes. Just I would like to share with you all, I mean, a personal reflection on the radon issue. So again, congratulations for the workshop. Very, very interesting meeting. But I think it's a common thought I always try to share in every radon event I attend. So in my opinion, we need to open more our events to the society. How to do that? That's the key question, but I think we need to probably bring on board professionals from other sectors, and I am talking like lawyers, experts on communication, journalists, and of course, I think the figure of a radon ambassador in some countries, like I can recall experience in Ireland, this helps a lot. If we can bring on board a VIP, I don't know, a sports person, or I mean, someone who is very popular, always the general public is more approachable if somebody who is not, let's say, so academic or so expert tries to deliver the message, but other person who is more recognized in the public, of course, with the advice on the background from the experts, can probably get much better the message across to the general public. So this is my thought. Yeah.
I always joke that
Yeah.
Radon has terrible PR. And
Exactly. I totally agree with you, Anne.
right? Yeah, asbestos and diesel engine exhaust, even
Correct.
fire smoke. People are much well acquainted with rather than radon, which, you know, there's actually a cartoon that shows a bunch of contaminants at a bar, and the radon is sitting dejected in the corner. So
Correct. I am pretty sure if I go to the supermarket right now and ask anybody about asbestos,
Yeah.
people probably will say, "Oh yeah, I know this is something," but if I ask about radon, nobody knows what it is. This is my feeling. So I totally agree with you. Our PR is, yeah, there is a lot of rooms for improvement, so to say.
Okay, thank you. I would like to give Gary a chance to respond now that you've seen what's going on up here in the north. Do you have any thoughts on potential synergies between our countries, or? And I think you're on mute. I know you have 2 lines coming in. Are you able to unmute yourself? You're trying. Okay. And we can read out your question, Craig. Please type your question into the chat and we can read it out. Pam has noted that we have a football promotion program here in Canada called Tackle Radon, which the BC Lung Foundation has recently signed on to. So yes, that is helping to encourage people to test using a sports figure. I mean, someone also mentioned TikTok, and I think that would be great. I think we need to branch into social media. Millennials are starting to purchase homes, right? Younger people are starting to be able to, and also, you know, live in homes and places where testing occurs. So I think we need to be looking to, you know, young people to help take on radon awareness as well. Is anyone seeing? So Gary, are you able to chat?
Yeah, I was finally able to find my mute
Okay.
button and unmute myself. Yeah, I'm very excited to find some synergies to move forward in. I'm really excited about the energy that I see here in your group, and I look forward to continuing to collaborate specific areas where we can. My mind is a flutter. I don't know any, you know, I don't know where to pin the needle first. But it's been a wonderful experience being able to participate with you all today.
This issue of deep energy retrofits and radon and renovations, is that something that your program deals with, or is that back more? I know the EPA has its indoor air quality plus health guidance, so perhaps that's in a different part of the government than where you're at.
So it sounds like we're having a lot of the same issues with that. You know, where the funding is. From the state program, from the state side where I'm at, we've been able to help a handful of daycares in some of our work to do mitigation work, but it's not something that we found a sustainable source for grant funding and therefore be able to provide funding for retrofits, but certainly something that we're continually looking at.
Great, thank you. Jeffrey, I think you were next on the session. Any thoughts for you from, you know, seeing the other speakers talk today?
Yeah, it was really interesting to hear all the talks. A couple of things that come to mind are Jose's talks about the EU's radon action plans. I admit I don't know too much detail about what's going on in the radon world. In Europe, it's you know, literally a world apart, but it's interesting to hear about that work and how looking at the geographic variation within countries is used to implement these radon action plans, which I think obviously from my position and the work we do here at the BC CDC is what we're trying to support. So I really appreciate that, and it's something for me to pin and read a little bit more about. And Gary, of course, it was really interesting to hear your work as well. Another thing for me to pin is to read more about the data guidelines that you all have in your data sharing agreements down in Washington. I will say when I came on to this project a few years ago, Emery and Dr. Sarah Henderson was briefing me on the project, and in our like project pilot funding materials, there's reference to the state of Washington's radon monitoring work there. So it's really cool to reflect back on that and to see your work presented here today.
Thanks, Jeff. I know it's so exciting to see the maps. I'd like to put them together. That's all I want to do is match them up. Chantal, thoughts from today?
It was so nice to hear from some people internationally and what they're doing and what they're seeing. So that was so great to bring them in as well and learn about that. One thing that I'm really glad that we're starting to have the conversation about is the relation between radon and energy efficiency. So I often see we do the air tightness testing, and we've been air tightness testing some very airtight homes. And we see that, when they turn on the dryer, even, it creates a significant negative pressure in the home. Same with any other kind of exhaust devices. So, I'm starting to see the potential effect and the potential impact that the airtightness, these airtight homes can have on radon levels. So I'm glad that that's starting to be discussed more.
Great, thanks for that. I've just been reminded that the annual Karst Radon Conference is in Victoria, British Columbia next year. It will be in April. It's open to everyone. Abstract submissions will be coming up soon. So just a plug for that before people go. And Brian, your thoughts on today? What did you learn, or people's synergies going forward?
Yeah, there's a lot of work to be done. I read the paper that you guys sent to me prior to this, and I was excited about all the, all the studies that have been done related to what Chantal talked about, the energy efficiency improvements and the known correlation between radon risk. It really it adds just a whole other, I guess, spectrum on the work that we do in sustainable building design and retrofits, and I feel like it's almost a lifetime's worth of work for somebody, for several people, just on the building side. And it's great that Chantal, Emery, and Jeffrey, you guys are doing that legwork. I'd love to see some of the correlation data, especially stuff here in the Okanagan from some of the people I've been working with, in particular hotspots that I'm seeing on the west side of the lake, all the way up from what we call our West Bench in Penticton up through Summerland, where it's a red zone, into Peachland and West Kelowna has just been lit up in terms of the tests that we've done out there and loaned out for people. So plus we have a passive house daycare, the only one that I know of, or at least the first one in British Columbia, that's on our campus here. And I'm wondering if it was part of that study you said for early childhood area. So at any rate, the wheels.
Great. Well, I'm going to stick around here for a bit afterwards. That brings us to the end of the workshop. It was fantastic and energizing for me. Thank you, Dr. Koo, for opening today. I feel also like we have a lot of work to do, and I think we need to find some more folks to come along with us. And I'd love to see you all at the Victoria annual Karst conference next year in April, because it is another great venue. And we will be trying to do outreach to the provincial government to solidify our, sort of potential for radon policy or more stringent considerations of legislation vis-a-vis what Jose has pulled together in the EU. So I'd like to see you all there if possible. And again, I'm going to stick around here if people want to chat or have any follow-up comments. And thank you all so much for taking the time to be here with us today, and to the Lung Foundation for making this possible. So have a great day for those of you who have to go. Thank you, Jose, and good night.
Thank you.
Okay.
Bye-bye.
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 Thank you, everyone.
Thanks, everyone.
Thanks, everyone.
Hey, Brian, when
Yes.
you do your research on radon levels, are you using digital detectors, or are you using long-term alpha track?
Yeah, we have the Centurion Pros.
Okay. So, it's
What's that?
Well, so the BC Radon Data Repository does collate research and data measurements that have been done historically across the province. So it sounds like, but we tend to use the Alpha Track measurements, which take 91 days to do. But if you have information about homes where levels where things are high, it might be interesting to also put some Alpha Tracks in there and get some measurements. I don't know, thoughts on that?
Yeah, sure. I mean, I just need to get my hands on them.
Okay.
I mean, I like the ability to, do they have Alpha Tracks that get our Wi-Fi or Bluetooth connected where we can monitor them remotely?
I don't know. You know, that's a question for Pam. I think, I don't know.
Okay.
I know that, so in Castlegar, Danish Schmidt, and have you met him?
I have not.
No, okay, so he tests the Correntia monitors and he leaves them for a long period of time. But for the data repository, we have to have Alpha Tracks. So in order for them all to be comparable, because they want to use consistent measurements. So
Understood.
but maybe we can get you some Alpha Tracks for your work, and so then we would have. I mean, we would need to leave them for 3 months, kind of at the same time, but it might be something to consider.
Yeah, for sure, definitely.
Anne-Marie, Pam
Yes?
says she can help.
Pam says she can help with that. Yeah, I think we can get you some Alpha Track test kits for that, because I think that would be really useful.
Okay.
Yeah.
It'd be interesting. I have next door to me is a brand new house that's actually a step code 4, and they're also monitoring radon thing. Probably from too many scary conversations with me. So we have a little side-by-side comparison going.
And there are 2 hands raised, Anne-Marie, for Greg and Pam.
Okay. Who was going to ask? Please feel free to unmute if you have a question. Oh, it's Pam and Greg, actually, and Noah. So Pam, you're on the top of my list. Please go ahead. There she is.
Can you hear me?
Yes. Brian, have you met Pam?
I don't think so.
Pam is the hub of the wheel of radon. So she's on the KARST. She's the ED of KARST, which is the radon scientist, and she also is the person that runs the professional certification entity, CNERP, and just knows everything about radon measurement. So Pam, go ahead.
Yeah, Brian, I was just going to say, under our Canadian National Radon Proficiency Program, we have been doing various research. So it would be great to be able to connect with you. We can provide you with devices, talk through some of the research that has been done, and sort of look at how we can partner with you. So I will be, I'm available virtually anytime. I will be in Kelowna at the end of March. So maybe we could connect then in person, or I could bring supplies or whatever at that point when I come on a personal visit. But yeah, it'd be great to connect.
Yeah, sounds good.
Excellent. Greg, you have your hand up. Greg is still muted. Oh, no, here comes Greg.
Can you hear me now?
Yeah, we can hear you now.
Oh, great.
Greg is the environmental health officer for the interior of British Columbia. So he's an EHO in your region. Brian.
Yeah, hi, Brian. We should connect sometime. I didn't realize you were here in Kelowna, and really interested in those tests you've taken up and down the valley. Shannon Lake, for example, on the map shown in one of the studies presentations today, that is in West Kelowna, but Shannon Lake is showing up to be what I would call a hot spot. And one of the questions I had for you in your net zero energy, the 1 to 1.5 air changes per hour, that you're speaking of leakage only there, correct?
I mean, it can be thought of as leakage, but it's essentially, it's how long it takes to completely have a volume exchange with fresh, what you call outdoor air. So a complete air change, right?
So in these net zero energy houses, what's the HRV or ERV, whichever term you want to use, I guess, what's it requiring for air changes per hour in these tight houses?
Right, that's a good question. There's no, I mean, ASHRAE has some standards that they recommend for air changes, but there's no currently right now, as far as residents go, there's no standard. And so ideally, like it depends really on the size of your home too, right? So how much volume as well. But there's really simple calculations that you can do based on the volume of your home, as well as the air tightness of your home. And a mechanical installer professional would do that for you. So it's a case by case basis. Sorry, there's no direct standard.
Thanks, Brian.
Thank you.
Noah has his hand patiently up. So Noah, go ahead.
Yeah, I can see it when I look at myself in the screen. Yeah, just Brian, I guess we're all sort of piling on you because we're interested.
We have Brian with you in the room.
It's okay. You're keeping me from having to go outside and do work. So I appreciate that. It's cold right now.
We really don't have good research on this sort of synergy between radon reduction and net zero homes. Like we did a review, and across the world people have looked at passive houses, but what we haven't looked at is really making the case that the synergy is not problematic. So where there's been good radon reduction in a net zero home. So even just tabulating what you're doing and writing it down and getting it out there might be really relevant, and I'd be happy to work with you on it too.
Okay. Yeah, I definitely think there's an opportunity there. When we think about passive homes too, these are homes that are required to have enhanced ventilation, right? Every passive home has a HRV. And when we get to higher levels of step code, they're also going to be required to have an HRV or ERV. You can't, well, actually now I don't think you can do it without one at step code 3. So, but that being said, there's not a lot of good correlation there. Like we don't fully understand for every home. There's so many variables that where an HRV or ERV is going to help. But if it's not properly installed, we could actually potentially increase the pressure differences between interior and exterior. We could actually do more harm if it's not. So the case for monitoring really, it just, regardless of whether or not you have a step code 5 passive house or just basic, whatever your local municipality requires, if you don't test, there's just too many variables, too many unknowns.
Pam Workington has her hand up again. Pam, are you responding to this? Or is that your historical?
Yeah, sorry, that's my historical hand.
Your hand, it was your historical hand. No, Brian, I agree. I mean, there's, again, in public health, there was this real assertion that we didn't need to worry about radon because we were building it out, and therefore we're going to work on a plan going forward, because who cares, right? Everyone's just going to buy a new house in the next 70 years and there'd be no radon problem. But I think what your work is really showing clearly is that, and some of the energy efficiency stuff we looked at, is that both new and existing homes are likely to have worse problems going forward.
Yeah, it's the elephant in the room. We're just not talking about it.
Yeah, I completely agree. Noah, is that a historical hand up, or do you have a new one?
Yeah, I don't know how to take it down.
Okay.
Oh, here we go. There, it's gone.
How about Greg though?
Greg, do you have a hand up? No, your hand is
Okay,
down
there we go.
as well. We really appreciate your coming. Obviously, we need more folks in the building sciences. So I think maybe we could have a meeting after Christmas to talk about building a coalition. I mean, I don't know if you met Dr. Koo before?
I have not.
Right, because he seems a pretty powerful advocate in your region. We did some work with the Cancer Agency in Kelowna to provide test kits for clinicians, and it seems to have paid off because it's raising awareness in that organization. And yeah, I think Dr. Koo's story is unfortunately not the only one that may be coming from.
Mary, there is a comment from Pam.
Oh, is a comment from Pam? Oh, Pam has said, any thoughts on improving construction techniques going forward?
Well, I think it was touched on by Chantel, just in terms of the trade sector that's installing these, I guess, radon mitigation systems, both in the install that happens at new construction, making sure that they're using appropriate materials, they're not actually compromising the radon ready systems prior to being activated. And then understanding the whole systems approach, that it's not just, you know, the fact that you're burying pipe in this radon rock or open void space, but you're also making sure the rest of that slab is sealed. And then also, I think that like the certification of radon inspectors, actually, that was news to me. I didn't know that radon mitigation specialists weren't required to be certified. I just assumed they were part of that. Because
they are supposed to be certified.
They are supposed to be. Okay. All right.
Yes.
All right. So some just are fly-by-night contractors then. But I've had some interesting conversations where really they have a black and white approach to it. They can't.
I was wrong. Pam says it's not mandatory, but it's because we only encourage people to use certified professionals. So she said it's, people can put them in who don't have certification, but I don't ever really engage outside of that world. So, okay.
On that area zone I was talking about on the west side, there was a client that had levels that were in the thousands. And this is on second floors too, with a central air system. And the radon mitigation specialist was really just taking like a standard approach and wasn't thinking about as a very complicated system, a whole system thinking approach to it. And, you know, they spent a significant amount of money, $15,000, and it did little to mitigate it, you know, when really the solution was something quite different than the original approach. So I just think there's a lot more need for education, both on the side of the install for the contractors, the trades, but also the radon mitigation specialists too.
Dr. Koo's experience, I mean, imagine on top of having lung cancer, you've got such a difficult home to mitigate, right? And that's, I get it that, you know, there's some beautiful homes in Kelowna, but they're complicated because of the geology and trying to maximize your view of the lake and all that kind of stuff. I could see that they're not your sort of bog standards split level suburban dwelling that we tend to have down here in East Vancouver anyway.
Correct.
Okay. And Steve Ferguson, you're on the line here. He's been doing some work comparing HVAC systems in schools and looking at the impact of HVAC in schools. I don't know if you wanted to unmute yourself and chat, but he's been doing some interesting work with Greg and how they're using the HVAC systems to help reduce levels in schools. Do you want to say a few words, Steve? I'll give you a sec to try and unmute. So this is for School District 53. They've been doing long-term sampling. So they have high levels of radon in some of the schools, but changing the HVAC system to come on just before occupancy is allowing them to control the radon levels in the school. And then they're looking at a cost benefit analysis. Is that right, Steve? Here, I'll see if I can unmute you. Noah, I can't
either.
No, I think sign on as a panelist.
Okay, so it's hopefully, Steve, I have conveyed so you're working with Greg. Greg, can you can talk, can you? You're working with Steve on this school project?
Yeah, can you hear me?
Yeah.
Yeah. Well, we're embarking on a free radon detector venture with schools, including first and foremost the school districts. And yes, part of the venture involves like, please give us data. Have you tested? We're finding that some districts have done absolutely nothing, like 0 tests, through to others having hired since as far back as 2010 or earlier consultants to do every 5-year tests, of which Steve has been involved in some of that. And coming forward is some I guess some creativity on mitigating buildings and looking at them from the context of occupancy and when are people occupied. It is a proven and approved method of mitigating is adjusting the HVAC, pressurizing up a building, just as we talked about earlier with HRVs. The only problem is it's subject to somebody going on the roof, flipping a lever or making an adjustment that nobody else knows about, and all your mitigation is out the window. And this is where I keep saying to school district management and folks, and I'm sure Steve can talk at length about this, and Chantel as well, They have to get radon on their routine indoor air quality agenda. It's not something you put a puck in for 91 days, get a result, walk away, and you're done with it. Now, we're not trying to scare everybody about being having to hire more staff and everything to make this happen. But this should be dovetailed in with all of their other indoor air quality measures, such as COVID, air changes per hour, and aesthetics and humidity and CO2 and everything. And realistically, every school district maintenance person should have a continuous monitor in their toolbox and be dialed into this. And where things get, difficult beyond maybe the daily grind, is bring in a consultant and work together with a consultant. So yes, we're all working on this and trying to make something happen in the IH schools, not just Central Okanagan, but the school districts in IH, which we have 16 or 17 of them, including the French immersion group that's provincial.
Greg, I think we should probably have a session at Karst on school testing. So I encourage you and Steve to write up a summary of the research that you've been doing and submit it as an abstract, because I'd love to have a session on schools. And Brian, I'd like to have a session on energy retrofits. If you're able to attend at that time, I think your voice would be very helpful. And you might know other people who would benefit from coming to the Radon conference in Victoria and learning a little bit more. Okay, it's 12:20. I have another engagement at 12:30 I have to go and do. So your moderator will be leaving soon. I am happy to allow you guys to continue though. So thanks so much. Man, I hope that the conference was everything that you were looking for today.
Yep, very much. And thank you for all the work and the support that you have been doing. And thank you to all the presenters and all the participants who have stayed on. Thanks so much. We'll see you next year.
See you next year or sooner in Victoria.
Oh, yes, in Victoria.
Yeah. Okay.
Thank you.
Thanks.
Okay,
Thanks
bye,
for
everyone.
organizing, man, and thanks for facilitating it. And Marie, appreciate it. And nice meeting everybody. Hope to see you guys in the future.
Yeah, you're
We
not
have
getting
to
rid of
see
us
you
now.
soon again, Brian.
Yeah, you're in the club now. So,
Yes.
okay.
All right,
Thanks.
have a good day.
Bye. And thanks, Pam.
Yes, Pam. Thank you.